Did you know that a fracture can't heal without gravity? Did you know you can actually speed up bone healing with natural therapies? Did you know that just sitting around for 6 to 8 weeks waiting for your body to do its thing might be slowing you down? Because healing isn't passive. Bone is active. And if you know how to work with it, you can help it build faster, stronger, and smarter than you've ever been told. In this video, I'm going to show you what most people have never learned about fractures, bone loss, and how to turn on your body's repair mode naturally. Let's get started. Bone isn't a brick. It's a living factory. Most people think of bones as solid, rigid, like concrete, but that's just the surface. Bone is alive. It's constantly being broken down and rebuilt. Your skeleton is like a construction site with 2 teams. The osteoclast, which are the demo crew clearing out old or damaged bone. And then we have the osteoblast, which are the builders laying down fresh, new bone. When these teams are balanced, your bones stay dense, strong, and responsive. When they're out of sync, you get bone loss, fractures, delayed healing, osteoporosis. Some bones will not heal. And why is this? I'll tell you about a patient who changed everything. Let me tell you about one of my patients. She was in her 50s, active, hardworking, tough as nails. She took a fall one day and broke her wrist. It was a clean fracture that broke both bones in her wrist straight through. They had to place metal plates and screws into her wrist just to hold the bones together. The surgeon said everything looked perfect, but weeks went by and nothing. No healing whatsoever. 4 months. Not a single sign of healing. No new bone growth, no callus formation, just stillness. She did rehab, she took the supplements, she showed up for every appointment. She wanted to heal, but her body wasn't cooperating. So I sat with her and we went through everything again. Then I asked her if she was still smoking. She looked away and nodded. Not just a few, she was still smoking a pack of cigarettes a day. I could see the guilt in her eyes. Not because she didn't care, but because she did. She was frustrated with herself, exhausted, and deep down, I think she was scared that her body had stopped working. I told her the truth. I told her that as long as she continued to smoke, especially that many cigarettes, her bones were not going to heal and they were going to struggle to rebuild. Because smoking doesn't just harm your lungs, it blocks collagen production. It disrupts circulation and it suffocates the exact cells that your body needs to heal. She quit that week and within a month, we finally saw it. New bone started to grow. Her wrist was waking up. Her body hadn't failed her. It had just been trying to heal in the middle of a storm. You don't have to wait around for healing to happen. Here's the 5 tools that I use to help bones build faster. Number 1, gravity. Bones are built on resistance. Without force and compression, they weaken. Even micro movements can signal repair. That's why astronauts lose bone density in space. No gravity, which means no pressure. So when you have a fracture, don't assume that total rest is the answer. But also don't take this as a green light to start running on a broken leg or lifting heavy weights. Smart, supervised movement is key. Even in a cast, safe partial weight bearing, just standing upright, shifting side to side, or using a vibration plate under guidance sends your bones a message. We still need you. Your bones are listening, even to tiny movements. That gentle tug, that soft shift in weight. It's not meaningless. It's instruction. It tells your osteoblast this structure matters. Reinforce it. Healing needs the right kind of pressure, however. You certainly don't want more damage. Think of it like a guitar string. Too tight and it snaps. Too loose and it's useless. You need the right tension. Number 2, ginger baths or compresses. Ginger isn't just for tea. It's a natural vasodilator, meaning that it opens up your blood vessels and brings in fresh oxygen and nutrients. That's exactly what your bone needs. Soaking in a warm ginger bath or applying a ginger compress directly to the area can boost circulation, help reduce inflammation, and relax the surrounding tissues. This isn't just feel-good therapy, it's biology in motion. Blood flow delivers the materials that your body needs to rebuild. But here's where it gets even more powerful. Increased circulation from ginger doesn't just help with pain, it enhances nutrient delivery, especially the minerals and compounds that your body needs to rebuild bone, like calcium, magnesium, phosphorus, and vitamin C, all essential for bone formation. Some studies even suggest that ginger's natural compounds may directly stimulate osteoblast activity. These are the very cells that lay down new bone. In other words, this isn't just a comfort ritual, it's a bone-building catalyst. Number 3, please quit smoking. If you do nothing else, do this. Smoking destroys collagen, the very structural protein that your bones need. Without collagen, healing stalls. But it's not just about collagen. Smoking also constricts your blood vessels. It reduces circulation to the fracture site. It also decreases oxygen and blocks nutrient delivery, and even interferes with the function of osteoblasts, the very cells that lay down new bone. Bottom line, smoking creates the worst possible environment for healing. If you're trying to build a house, smoking is like working in a thunderstorm with no tools and a team that's constantly being poisoned. Quitting, even temporarily, can dramatically shift the odds in your favor. Number 4, vitamin C and cofactors. Vitamin C isn't just for immune health. It's critical for collagen formation and repair. Pair it with nutrients like zinc, magnesium, vitamin K2, and boron. This combination helps create strong, flexible tissue. And number 5, weight-bearing exercises. When you are cleared by your doctor, movement is your medicine, but only when it's done safely and under professional guidance. Walking, light resistant bands, or even isometric holds after your doctor says it's safe tells your bones, hey, we still need you. And it's not just about motion, it's about messaging. Every time your muscles pull on bone, they send a signal. Reinforce here, build here, strengthen this spot. And over time, those signals translate into thicker, denser bone. It's how you went from baby soft bones to adult skeleton in the first place. And it's how you keep what you've built. But be careful, the wrong movement too soon can backfire. So don't go lifting heavy weights or jumping into high impact exercise before you're ready. Think of this phase like laying concrete. The foundation initially is wet and fragile, so make sure to let it set with the right support and then build from there. I had a patient, a young dancer, who came into my office in tears. She had tiny microfractures in 2 of the long bones in her foot, the metatarsals. And the worst part, she had a major dance competition in just 10 days. She begged me for help, not just to heal, but to dance. I told her that I'd support her as long as she agreed to 3 conditions. 1, she had to come into my office every single day for laser and acupuncture therapy, even on weekends. Even on my day off, I promised to be there, including Sunday. 2, she had to do 2 ginger baths a day for 30 minutes each, no exceptions. And 3, she would go in to get a complete x-ray series before the competition. And if there were no signs of healing, she wouldn't perform. No argument. She agreed. She followed everything without missing a beat. 10 days later, her x-rays came back normal. 2 clean, healed metatarsals. And she danced. She gave it everything she had. That moment, it reminded me of something that I see time and time again. Healing isn't just biology. It's not always about time either. It's about intensity. It's about consistency. And most of all, it's about creating the right environment so the body can do what it was designed to do, to repair, to rebuild, to come back stronger. Bone health isn't just about age. It's about communication. Your bones are trying to heal. Are you sending them the right signals? One small shift can spark everything. And there's more on the way. Subscribe so you catch everyone. Thank you for spending time with me today. Remember, the best investment you'll ever make is in your health. Click here for the next video in this series. And if you want more content like this, go ahead and subscribe and drop a like. Let's keep moving forward together.